watch this video on key factors to consider when designing a hospital. Please do not forget to subscribe, like, and press the bell button to watch our new videos like this. Please leave your comment on your topic of interest. Designing a hospital is a complex process that requires careful consideration of numerous factors. The design of a hospital must not only provide an environment that is conducive to healing, but also be efficient, safe, and practical for the staff and patients. In this video, we will discuss the key factors to consider when designing a hospital. 1. Patient-centered design. The primary focus of any hospital should be the patient, and the design should reflect this. Patient-centered design is based on the belief that the environment has a significant impact on a patient's well-being and recovery. The design should be welcoming, warm, and comforting, with a homely feel. The patient's needs should be prioritized, and the design should be such that the patient feels comfortable and relaxed in the environment. Patients should feel safe and have a sense of control over their surroundings. This can be achieved by providing private rooms, comfortable furnishings, and soothing colors. 2. Functional design. While the design of a hospital should be patient-centered, it should also be functional. The hospital should be designed in a way that makes it easy for staff to move around and provide care to patients. This means that the design should be efficient, with clear and straightforward layouts, to ensure that the hospital runs smoothly. 3. Safety and security. Hospitals are places of healing, but they can also be hazardous environments. Therefore, it is important to design a hospital with safety and security in mind. The design should include measures to prevent the spread of infectious diseases and reduce the risk of accidents. This can be achieved by providing hand-washing stations, using non-slip flooring, and designing areas that allow for proper disinfection. 4. Technology integration. Technology has become an integral part of modern healthcare, and hospitals must have the infrastructure to support it. The design should include the necessary technology to ensure that patients receive the best possible care. This can include electronic health records, telemedicine, remote monitoring, and real-time tracking systems. The hospital should also have the necessary infrastructure to support these technologies. 5. Accessibility and inclusivity. It is important to design a hospital that is accessible and inclusive to all patients. This includes patients with disabilities, seniors, and children. The design should provide for patients with mobility issues, such as wheelchair ramps and lifts, and should be easy to navigate for those with vision or hearing impairments. 6. Flexibility and adaptability. The healthcare industry is constantly changing, and hospitals must be designed with flexibility and adaptability in mind. The hospital design should allow for future changes in technology, patient populations, and medical practices. This can be achieved through the use of modular construction and the incorporation of flexible spaces that can be easily modified or repurposed as needed. 7. Sustainability. Finally, the design of a hospital should be sustainable, both from an environmental and financial perspective. This means that the design should incorporate energy-efficient materials and technologies, the integration of green spaces and outdoor areas, and water conservation measures. Sustainable design can help reduce operating costs, improve the health and well-being of patients and staff, and reduce the environmental impact of hospitals. Conclusion. Designing a hospital requires careful consideration of numerous factors, including patient-centered design, functionality, safety and security, technology integration, accessibility and inclusivity, flexibility and adaptability, and sustainability. By carefully considering these factors, healthcare providers can create hospitals that provide the best possible care for their patients, while improving efficiency, reducing costs, and minimizing the environmental impact of hospital operations. Thank you so much for watching this video on key factors to consider when designing a hospital. Please do not forget to subscribe, like, and press the bell button to watch our new videos like this. Please leave your comment on your topic of interest.